Hi, I'm Dr. Tim Becker of Becker Audiology in Waukesha, Wisconsin, and of AUD Hearing in Lake Geneva, Wisconsin. Today I'd like to talk to you a little bit about a condition known as tinnitus. Tinnitus in some patients can cause very significant problems related to what is in essence an anxiety reaction to the tinnitus signal. In many cases, the patient gets very poor information about the condition and can really suffer a great deal from it. The cause of tinnitus in virtually all patients is simply they have some hearing loss. Tinnitus is a normal and expected side effect of hearing loss. The hearing loss can be so small that you don't even realize you have a hearing loss, but in virtually every patient I've ever seen with any type of ringing or hissing or cricket or cicada type of tinnitus, it was simply caused by a hearing loss. The problem is the patient is typically not given this information, and so they sit there wondering what's causing this constant noise. When I look at tinnitus patients, I really classify them into two types. There's normal tinnitus. There's probably about 50 million people in this country who've got tinnitus. There's about 50 million people in this country who've got hearing loss. They've done studies and they've shown that there's 99.6% of people with hearing loss have some tinnitus. And so it shows you it's an extraordinarily common disorder. But then there's a subgroup of these patients who have something that I call problem tinnitus. With problem tinnitus, the tinnitus goes from this soft ringing sound that they hear occasionally to something that becomes just an ever-present, highly bothersome signal that can have a lot of side effects. The patient with problem tinnitus not only hears the tinnitus, but in most cases they have really what is in essence an anxiety reaction or anxiety disorder because of the problem tinnitus. Typically when a person has tinnitus, they learn to ignore the tinnitus very easily, and like a lot of sounds in our world, we ignore them. Right now I can hear a heating fan in the background where I'm sitting. I typically would not even have heard that. My brain would ignore it. Our brain is excellent at really ignoring many unwanted sounds in the environment. But what happens with tinnitus patients is their brain treats the tinnitus signal in a fashion that in essence elicits the fight or flight response in the human brain. And the best way I can usually explain what this means is to give you an example of two different signals that are virtually identical. Just say, for example, you're sitting and there's a child playing with a baby rattle. That sound will go into your auditory system. Your brain will identify it as a benign, no problem, it's a baby rattle. Why worry about it? You'll learn to ignore that sound very quickly. But how about if a rattlesnake came rolling into your room and you heard really what is in essence the same sound? Your brain would have a completely different reaction to that sound. At least mine would. Instead of just being a sound our brain would learn to ignore, that sound would leave our auditory cortex and actually create a very significant anxiety reaction in the center of the brain known as the limbic system. It's not important that you remember what part of brain this is, but quite simply, our brain has the feature in it that we will get nervous to sounds that we view as being dangerous. Well, in essence, and to put it very simply, your brain has learned to treat the tinnitus signal in really the same way as it would that rattlesnake sound. Well, as long as that rattlesnake is in my room, I'm going to be nervous. In essence, since tinnitus really doesn't go away, your brain will continually listen to that signal and continue to sit and worry. The tinnitus signal itself is really created by your brain in response to your hearing loss. It's a very similar condition to what happens when a person loses a leg or to say loses an arm that's been amputated. these patients will still feel their arm and they'll have a pain where their arm or hand used to be. It's called a phantom pain. Tinnitus is really the hearing version of that. Your brain senses a lack of auditory information coming from your ear, and your brain tries to replace that sound with sounds that it makes up. For most patients, that sound is typically some form of high frequency hissing or whistle or whatever. And so like I said, for most patients, millions of them, it's really a non-important thing. With the patients who have problem tinnitus, really they present to me with what is in essence a chronic long-term anxiety disorder. I view problem tinnitus not as so much a problem with a hearing loss or anything like that, but it's really that this person exhibits a very significant anxiety disorder. They'll often have problems sleeping. They'll have a hard time concentrating, even to a point where they have a hard time working. And I've even had patients, not being able to work. They'll often have a feeling of malaise. Life isn't good anymore. They'll often have a loss of hope because they really can't dream of having to live this lifestyle the rest of their life. Well, the good thing about it is that's actually a very simple condition, and in most cases, a very simple condition to treat. The treatment we use is something called Tinnitus Retraining Therapy. It's a method that we first of all counsel the patient extensively to really have them understand what's going on. If the person has a lot of misconceptions about what causes their tinnitus, they'll never really learn to tolerate it. Then, for patients who do need this, we actually have them wear a wearable masking device that will, in essence, cover the signal so you don't hear it. If you don't hear it, it can't bother you. It'd be very similar in my analogy to the rattlesnake. If you take the rattlesnake away and that sound's gone, you're not going to elicit that same negative anxiety response. This is a very short description of what we do, but it's been proven to be successful in about 85 to 90% of people. So what I want to tell tinnitus sufferers is, first of all, it's a disorder that's really quite easy to explain, but it's also a disorder that has a very effective treatment. Patients I see will often run about on the internet, taking these medications or these herbal supplements that really have been proven to not work at all. You're wasting your money. Tinnitus retraining therapy is a successful method when followed properly. In most cases, gives the person very significant relief very quickly. If you would like more information about tinnitus, I'd be happy to talk to you. Please give me a call. My phone number is 262-717-9000, and hopefully this short video was helpful in describing tinnitus for you. Thank you.